Welcome and thank you for waiting. So my name is Ninka Somerdijk. I am a co-lead of the PoCoG Early Special Interest Group together with Emma Kemp, and we are delighted to be hosting this workshop on when and how to involve community members in our research. And it is our hope that this will be an interactive space for everyone to discuss, also some of the challenges that we face as early career researchers in designing consumer-centered research. So on behalf of the PoCoG Early Career Research Group, I would like to acknowledge the unique position of Aboriginal and Torres Strait Islander peoples in Australian history, culture and society. And I would also like to pay my respect to their elders, both past and present, and extend that respect to other First Nations Australians online today. So I am going to pass on to Emma Kemp now, who is going to provide more of an introduction on consumer engagement research and introduce our speakers for today. Thanks, Emma.
Great, thanks, Ninka. So I'm sure for everyone who's dialed in today at least has some interest and some recognition, hopefully, of the value of consumer involvement in research. And we all know that that's something that's really important to do. So to just briefly sum up why that's important, I think, it means that we can, for example, design appropriate interventions in which we're confident that they're going to meet consumer needs and, they can meet a range of perspectives, hopefully, because we've had the, community member perspective woven into our intervention, if you like. Consumers are also fantastic people to work with that can make incredibly helpful contributions right from the start, from the grant application right through sort of promotion of the study, recruitment of participants, running of the study, right through to presentation and publication. And what I find really important is that consumers or community members often really understand the value of the work that you are trying to do. And for that reason and others can be really motivated, interested and supportive people to work with. So it's definitely, it's exciting and something that we really want to do as much and as effectively as we can is to involve consumers or community members in our research. But I think it's important to note that not everybody is sure how to identify the consumers that are experienced in their specific research topic or most appropriate to involve in their research topic. And not everybody has the opportunity to approach consumers or community members who are, I guess, the most appropriate for their project. And this can be particularly the case for ECRs, because ECRs often, it's not only the level of experience that they don't necessarily have as much of yet, but also they don't necessarily have the extent of networking that mid or senior level researchers can have in order to be able to, I guess, find and approach consumers who are experienced in the topic that they would like to research. So that was, I guess, the initial reason that we really wanted to run a seminar on consumer and community involvement that was specifically looking at engaging ECRs. So we know that ECRs both have challenges that are related to the career stage, but also benefits. So I've talked a little bit already about, you might be employed on, various short-term contracts and things like that can really impact on your ability to network also. And you might be limited to smaller projects in which it's not necessarily that easy to have either the time or the funds to be able to effectively engage a consumer or a community member. But on the flip side, you might have less responsibilities than mid-level or senior researchers. And you've also probably become a researcher in an environment where consumer engagement is more and more the norm. Like I think we're all very aware of the importance of that. Hopefully everybody is already aware about some of the challenges listed on this slide, but I did want to just I guess have a little bit of an overview here. People can probably read most of the kind of individual reasons for themselves without taking up too much time. But I think it's important to understand that there are some challenges in consumer and community member involvement in research. And so the reason I've got these up on this slide today is because they really do impact on the how to involve consumers and community members in research. So, there can be personal or practical challenges, including things like other life commitments or treatment schedules, and they can contribute to things like burnout. It's very important, therefore, to be able to set effective boundaries. There are some challenges in the research environment. We've just had it recently that we're trying to submit a grant application, and it's very much, the form is very much formatted for a researcher with an academic background. When you're trying to involve a consumer as a chief investigator, even that part of it can be challenging. And there can also be challenges in representation. So we know, for example, that people who tend to be trained in, community member advocacy tend to be very well educated, articulate, and so there can be challenges in representing groups who may be less educated or less articulate, just as one example. Oh, I've gone too far ahead. So that just gives you a very quick background as to what our, I guess, aims are for today. So we're really talking more about the nitty-gritty of when and how early career researchers in particular can involve and engage consumers and community members actively to help shape their research. So we've got kind of two parts to today. Part one is a panel session. So I'll lead a discussion with the panel members who've dialed in. And then after that, we'll have a Q&A session where you can ask your burning questions. But you can also ask your questions via the chat function during the panel session. So please just be aware of that. And a couple of people have volunteered to help me keep an eye on the chat. So hopefully we'll be able to do that effectively. So to introduce our panel members who have very kindly given their time to this today, if people can maybe give a wave or say hello when I introduce you. We have Ian Davis. Ian's a medical oncologist and is affiliated with Monash University. He's also the chair of the Australian and New Zealand Urogenital and Prostate Cancer Trials Group, or ANZUP. I'm not sure whether we've had Juliet dial in yet, Tiffany. Yeah, we think that our consumer advisory group member might be having some technical difficulties with dialing in, so we're trying to follow up on that. And then we also have Rebekah Laidsaar-Powell, who's one of our own PoCoG members and affiliated with University of Sydney, and Kirsty Galpin, also one of our own PoCoG members and affiliated with the University of Sydney. So I will stop sharing the screen so we can see our panel members. Can everybody, is that stop sharing effectively, Tiffany? If you give me a nod.
Yeah.
Cool. Brilliant. All right. So yes, thank you to all of our members for your time today. To start us off, Beck, I might ask you, just to give us some background, in what ways have community representatives been involved in your research, and more specifically, when have they been involved? So at what stage of the research trajectory, and how did you approach them, and then what roles have they had?
Yeah, absolutely. Well, thanks so much for the opportunity to be here and speak. I'm really thrilled to be able to contribute. So I guess over the years, I've been involved in a number of different kind of research projects where community members and consumers have been involved. Today, I'll speak mainly about two projects that I've been involved in, eTrio and my current project, Carers Can Adapt. And each have had kind of varying levels and styles of consumer involvement. So I guess eTrio, first of all, which I can kind of go into first. So this was a really large project, which was around developing an online intervention to improve the way that carers and clinicians could kind of communicate, and particularly how can we, improve the way that carers feel, agency in medical consultations. So I guess before I do the when and how and what, I'll do the who, because I guess that's another element to this is the who. And so for eTrio, there were kind of three key community representatives that we needed to capture the perspectives of. So that's obviously carers, as well clinicians, as the ones doing the communicating and the ones that, we were doing a lot of the training with, and then also people with cancer, because the communication was about them, and we needed to make sure that what we were doing was relevant to all kind of members of the triad. And we knew that we needed to kind of integrate their voices. So I guess the when, it's been a progression in many, you know, programs of research. It starts small, but then, you know, over the years it grows bigger and bigger. So the when is kind of hard to say exactly, but early on in the piece in my PhD, we had some consumer input. And those consumers were brought in through a consumer advisory body, and who were able to contribute over a number of years. And really at that point, this was before it became eTrio as a grant though. At the grant submission stage of eTrio, those consumers had kind of moved on in life. And so we didn't have any carer consumers, but we did have a number of clinicians who were, you know, chief investigators and AIs helping us as well. And I guess we'd done a lot of qualitative work back in the early formative stages, which, you know, through the voices of participants was really helping us understand what was needed from that group. So I guess once we had funding and the project was up and running, we then brought in consumers, so carers and people living with cancer into the project. And the kind of how of that was we went to a cancer consumer organisation, and we requested both carers and people with cancer. Amazingly, we ended up with 3 carer consumers and 3 patient or living with cancer consumers of people who were willing to contribute to the development of the intervention, which was really fabulous. And so we were kind of provided with their contact details, and we made, you know, contact individually with each one, checked they were interested, explained the study in more detail, and then discussed their kind of capacity to contribute. And I guess to wrap up on the kind of what did the consumers throughout the course of the study contribute. So I guess for the carers and the patients in our consumer panel, we were developing an intervention content, and which was about educating and informing carer communication. So we had kind of an early draft. We provided the consumers with a draft of the information via email, explained what we were doing, and then we set up an in-person meeting where everyone came together, which was fantastic. And, you know, we provided food and drinks and reimbursed their expenses. And then together we kind of all spoke about the intervention content as a group. And then we went away, revised it, and then individually sent people kind of the iterative revisions and got their feedback. So, I mean, the carer and patient involvement for that this was over quite a period of time. So this was probably a year of iterative refinement. And, you know, we met people where they could contribute. I guess that was one of the things that was really important, is that sometimes people's capacity increases and sometimes it's lower. So I guess that was one of the benefits of having multiple people, is that we could, you know, sometimes people couldn't contribute to a certain round of revisions, and that was totally okay. The carer and patient involvement at that kind of ended at that point. Once the intervention was designed, web developed, up and running, we'd done the user testing. But at that point, then the clinicians really, you know, the clinician involvement and the community organisation involvement, so the broader kind of community organisations really took on for, you know, a role for the recruitment. Yeah, so I guess that's a long-winded answer about the hows and the whats and the whys. But it's absolutely such a crucial part, and the intervention itself benefited so much from having the diverse perspectives of the consumers.
Brilliant. I'll call it detailed rather than long-winded. I think it's a great answer, and it's excellent to have, you know, I guess that real story of you know, how it was done and what was done. So Kirsty and Ian, I don't know whether either of you would like to chip in and say how that, you know, aligns or maybe is different to the experiences that you've had. Kirsty, you're unmuted. Would you like to go first?
Yeah. Thanks, Emma. I'd just like to say thanks as well for the opportunity to come along today and talk. My experiences are kind of resonate a little bit with Bex. I think we probably all have similar experiences. I was going to talk about refer to a project that we did, which kind of involved community representatives to develop a measure, and we actually were developing a national survey. And we early on, when we were kind of brought on to assist with this project, it was aware to us that we really needed to involve our community representative very early on. they were going to be the people that kind of really knew what the key messaging was, the people, you know, we were building this measure for people within that community, and they knew this community better and what was relevant to them, what was going to be important, how we should form things. So we did get in early, and we used a kind of a very kind of closed design approach with them, and we also did a face-to-face, which I think was quite important to bring everybody together. And it was a really, they were involved from the kind of in all steps, from the wording and the language that we were using in this was really important, the types of questions we were asking, the order of the questions that we were asking. So it was really important that we were making sure that everything that we had in that measure was relevant and was meaningful to them and was acceptable as well. So, and by having them part of that process, really made sure that we were ticking all those boxes along the way. And it was also, we used a very kind of iterative approach of process there. So we went back and forth and received feedback and refined our measure with them as well. And I think doing that kind of built that engagement and also fostered confidence, and they felt really valued in that process as we went along. And so they were really, really engaged. And we were fortunate enough that we were able to kind of engage with our community of representatives through a cancer organisation, which was helpful. So they were part of a lived experience group. So in that sense, they were also already quite engaged and quite motivated when they came along. So that was really helpful for us. But I think if that's covering the when and the how, it's a much shorter kind of explanation than Beck, but I think without having to repeat things again. But I mean, just having these people involved early was so important. We were lucky through how we were able to engage them as well, but we were able to make sure that it was a positive experience for everybody. So for us, from myself, I kind of reflect on it as very positive, but the feedback as well we had from our community representatives during that process was really positive. They felt like their voices had been heard and they were really able to kind of make a difference to the specific priority groups that they were representing. And we did able to get quite a diverse group of people. It was a national survey, and we involved breast cancer and people that had experienced breast cancer, but we were able to have people come along from all those priority groups that we wanted to be able to be recognised in that national survey. So yeah, I hope that helps.
Brilliant. Yeah. Ian, sorry, would you like to go next?
Yeah, thanks. Great to be here. Thanks for the opportunity. I'm going to just tell a couple of little stories, some successes and also some what I think are epic fails. So I'm here today, as you said, wearing a couple of hats, but mostly going to talk about my experience as chair of ANZUP Cancer Trials Group. And for those of you who don't know, it's one of the other cooperative trials groups funded by Cancer Australia, as is PoCoG. We involved in genitourinary cancers, below the belt cancers, so prostate, kidney, bladder, testis, and penis. And we work really closely with PoCoG. In fact, Harry Dillon is the chair of our Quality of Life and Supportive Care Subcommittee and member of our Scientific Advisory Committee. So thinking about it from an organisational level, but also from a project level, when we were setting up ANZUP back in 2007, 2008, it was an absolute requirement that we have an effective consumer advisory process within the organisation. And that was really my first serious involvement with all of this in terms of setting it up. We were very fortunate to have fantastic support by initially Ian Roos and John Stubbs, who have been known to some people, and then more recently Leonie Young from Breast Cancer Trials, who's also now part of our consumer advisory panel. And I'll talk a little bit about how that was set up. We were very fortunate that in some ways our consumer advisory panel members self-selected, but we also had some really engaged clinicians and investigators who were going out and identifying potentially suitable people. And to cut a long story short, we managed to bring together a group of people that represented the range of diseases that we deal with, because there's quite a few. We're conscious of diversity across gender, background, cultural background, disease type, and nature of the experience. We're conscious that we wanted to have sufficient numbers, but not overwhelming numbers, because we wanted everyone to have a voice. And the really overriding priority was to ensure that the community input was more than just a box ticking exercise and more than just a number. There's nothing worse than for a consumer, I think, than to be part of a committee, a group, a steering body, a grant a grant governance process or whatever it might be, and just be yet one other voice, particularly when you've got big names, big voices, big egos, big personalities who can sometimes overshadow them. So in ANZUP, we've set up our processes specifically to make sure that not only are they voices that can be counted, but they're considered qualitatively in a very different way. For example, when we're ranking grant or fellowship applications, we have expert content reviewers for the grants, and then our consumer advisory panels spend an enormous amount of time going through these applications as well and ranking them. And their input is not just a score, but it is actually a qualitative weighting. You know, they might come up with a ranking that's slightly different to what the scientific reviewers come up with, but they say, yes, this might score a little bit lower on that, but we think that this is important. And that is something that the board and the Scientific Advisory Committee takes into account very, very seriously. So the nature of the input is more than just a number. It's very, very important that we get that right. In terms of what the people bring, we're looking for people who can obviously be an advocate for their disease, but also for cancer treatment, cancer research, cancer clinical trials. So there's a two-way process of communication to us about what the scientific direction of the group should be and how we do what we do, and then back to the community in different ways as well. Their lived experience is important, but it's not necessarily the be-all and end-all. So, for example, the chair of our consumer advisory panel is someone who has not actually had a genitourinary cancer herself, but her daughter did. So is intimately involved and brings a different sort of perspective. So that lived experience is important, but also we wanted people with some experience in research, and particularly in clinical trials and other aspects as well. It's important that the communications are free and open and really are a continuing alignment check for the organisation, that we are proceeding scientifically and strategically the way that the community thinks that we should go. And it's really quite remarkable how quickly and effectively our consumer representatives glom onto that sort of thing. In fact, they do it far more effectively than grant reviewers do. I can tell you that much. They will instantly see, yes, this is why this is important. Even it might not be the scientifically most sexy approach, but we think it's a really important initiative that we should be doing. So we involve the Consumer Advisory Panel at every level of the organisation. There's input from the board, the Scientific Advisory Committee, all of our subcommittees, and in particular at our ideas generation workshops, which together with our subcommittees are really the engine room of the organisation. This is where our trial ideas first come up and are polished up and expanded. And our CAP members are fantastic. They will attend, they will read the information, and they will have active input into all of that in terms of helping us polish up the design and the strategic direction. One thing that's come out of that is that we all love to use jargon, and sometimes we're not even aware of when it's being done. So we've again altered our processes to make sure that the lay description of the projects is truly lay, and it's more than just 3 or 4 lines, that it's something really substantial. And in fact, that's turned out to be really useful. When I'm preparing a concept myself, I always write that section first, because if I can't articulate it in lay language that's going to be understandable to these people, then I really can't communicate it effectively otherwise. So it's actually very useful for my own purposes as well. It's critically important that we provide support for people to attend our activities, including our annual scientific meeting, the ideas generation workshops and so on. That includes paying for travel and accommodation and registration, and to have an ongoing educational program, which we integrate with our annual scientific meeting and other events during the year. We don't pay our CAP members, and in fact, several of them have said that they don't want to be paid. That's just the way that we're doing it. Others may do it differently, and I don't think there's a right or wrong way of doing that. So that's worked really, really well for us. And if you just give me indulge me just for a minute more, I'll tell you 2 ways where consumer involvement has, in my opinion, not worked as well as it should. First is at my health service. I don't want to hang them out, but we're all looking at integration of the National Clinical Trials Governance Framework under the national standards. And Standard 2 now involves consumer representation at all levels of governance within an organisation. How do you do that in a health service? Moving away from trials group, how do you do it in a health service? What does consumer involvement mean in terms of governance of clinical trials that are happening at a health service? Very few health services have actually worked that out, and the framework gives no guidance as to what it should be. So should it be someone with cancer? Should it be someone with governance experience? Should it be someone with just broadly representing the community? How do you select that sort of person? How do you train them? Monash University has got quite a good resource in terms of community and consumer involvement. It's got a toolkit for helping identify people and train them up. And there'll be things like that that are useful elsewhere. The last point I want to make is another fail. A number of years ago, I was on a panel that was reviewing a program at a university that I won't name, and I won't try not to give away any details. And they proudly introduced us to their consumer representatives. Great group of people who are actively engaged in all aspects of what they were doing. Based on their lived experience with this disease type. And when I spoke to them, one of them was a retired high-ranking military officer. Another one worked in major events organisation. Another one worked in logistics. And none of these skill sets were being used by the organisation. They had incredible expertise that this organisation could have been using and was not being tapped into. So these people are experts in their own areas and beyond their disease involvement, and we shouldn't be afraid to allow them to offer that for the benefit of the organisations either. I'll talk a bit more about grants later on perhaps, but that's probably enough for me for now.
Thank you so much, Ian. I think, again, a detailed answer, but it's given us a lot to think about. And I think being able to talk about the failures is important to understand, what should be done and maybe what shouldn't be. I'd really like to now welcome Juliet, who's being able to dial in. So Juliet is a consumer advisory group, or a PoCoG consumer advisory group member. And we're so happy to have you dial in today, Juliet, to give your perspectives. I wanted to start out by asking you, what were your reasons for deciding to contribute as a PoCoG community advisory group member or representative? Why do you think it's important from your perspective to provide your perspective in research?
Thanks, Emma. And yeah, I do apologise for my late arrival. So I decided to join last year, kind of early in the year. I was just coming off the end of being treated for breast cancer myself, which I'd had about 15 months of treatment, so active treatment. And before that, I had been a carer for my husband who passed away from pancreatic cancer in 2020. So I felt that I had some experience. So as I will be saying throughout this webinar, I am just one person's experience, but I felt that having the experience of being a patient and a carer would be quite useful input. And also I do work with high degree research students as part of my job, and I know how important it is to hear the voices of the people who will be benefiting from research, and not just assuming that you know what they might be. So I wanted to, I feel that that's really important as good practice for researchers in designing their projects as well.
Absolutely, yeah. So I think a little bit like how Ian was saying, you know, having that involvement in project planning, and in fact, you know, I'm sure at PoCoG we would all agree. So that's fantastic. Thank you. Following on from that, I guess, beyond your sort of initial reasons for deciding to contribute as a community representative, what do you personally look for or aim for in your research involvement? So sort of what do you hope to gain, and what do you aim to contribute?
Yeah, so I guess I'm motivated by wanting to contribute. I mean, in terms of cancer research, I think many people would want to contribute to that in any ways they can, financially or through other means. So I have that intrinsic motivation to make cancer research better and to benefit as many people as possible. And through well-designed studies, that's going to make that process better. So I think I want to contribute by, I guess, removing obstacles to make clinical trials and research projects work more efficiently and be, so if there are obstacles, for example, I think this was already mentioned by Ian and the others, that if the language is not accessible, then you could lose a large group of potential participants in your studies just because of the language, and that one, we can remove that. So my background is actually English linguistics, so I feel that I could also contribute in that way into sort of, I guess, gauging whether I think that this would be accessible. I have no medical background, so I have expertise in English language, but not in cancer research and in medicine. So yeah, removing some of those obstacles to participants. I guess, yeah, I in terms of, I would prefer not to be paid for this. I'm one of that type of person. Yeah, so I think I'd just like to be able to contribute to the research projects working as efficiently as possible.
Fantastic. And I think what you're saying, you know, that you don't have a medical background means that you'll be the perfect person to be able to pick up when that medical jargon that Ian was speaking about is, you know, being used in a way that's not accessible to everyday people. And I think that's something that we tend to forget. Even if we're not medical researchers, we tend to use research jargon. So yeah, making sure that we're not using that, I think, is really important. Circling back maybe a little bit to something that Beck was alluding to earlier, do you think there are considerations that researchers should be aware of? We're all, you know, very mindful of the importance of community involvement, but what kinds of things do we need to be aware of with regard to the capacity of community representatives to contribute, and also mindful of what factors enable people to have a positive experience from their involvement in research as community representatives?
Yes, so I think that it's important that you don't have a stereotype of what a carer would be or a person living with cancer would be, that you might think, you know, they're, you know, an old person or a certain language background or whatever. And it would be important to get the input from a few community advisory group members who are ideally different from each other. So they're not all falling to the same ethnic group or age group or gender or social class. So I think that that's quite important. So I can represent a certain viewpoint. But even if I was completely different from the other community advisory group members, my experience of cancer will be particular to me, so I can give that point of view. So try and get a few different people. Also, they could be quite busy, so they're not necessarily just, I don't know, twiddling their thumbs waiting for this request for their opinion, that they have, you know, jobs and families to look after. So I think it's helpful for me if I know the time commitment. So even if you indicate, I have this concept that I'd like your advice on, it should take you about 15 minutes to read through, or it will take you about an hour. So being honest, like if it is going to take an hour, that's not necessarily going to turn people off. It's just, okay, I'll need to allow an hour, because I don't like it when I start something that I think is going to be 10 minutes and I end up taking a lot longer. That makes me quite cross. If I knew it was going to take an hour, I would have allocated an hour to it. The other thing is that if there's a few documents to read, it's helpful if you tell me which documents to read first, because sometimes I read the wrong one and then I'm like, start writing all this feedback, and then I think, I open the next document and, oh, there are the answers to all of those questions. Scrap all that, because I read them in the wrong order. So indicating, you know, read this one first and this one, or this document, the target audience is this group, this other document, the target audience is that group, so that I know sort of which hat to put on when I'm reading which document. I think that what I've heard from the others who've already spoken, that ongoing iterative process, I haven't been involved in something like that, but I think that would be quite helpful. So I think knowing that your feedback is taken into account and where it's made a difference. So we heard that, you know, from the CAG that this particular section was quite onerous or difficult to understand, so we've changed it in this way. That can be, oh, okay, so you know, my feedback was helpful. Also, hearing what other CAG members put in, that was helpful for me. So even if it's not the response of the researchers, but just hearing what others said, that also helps me, because I'm fairly new, I think, in this group. So I wasn't sure how much detail to give and what sort of things to look out for. Having said that, it's good not to have all the CAG members in discussion, because they'll maybe just align to one. So you do want to get a diversity of feedback, but at the same time, you don't want them wasting their time giving feedback on something that the researchers are not going to use.
Okay. Yeah, I think that's really important from what you were saying, like, you know, for people to actually know that what they've said has been used and taken into account, and how it's been taken into account, not just sort of having that assumption that it's been used somewhere or listened to somewhere, because that
or
makes
that it's the box ticking thing.
Yeah. That's exactly the word that comes to mind, isn't it? Sure. I'm going to go back to Ian for just a minute, and I'm not sure actually how much of this came up from what you were speaking about previously, Ian, but just around what kinds of differences and similarities you see that there might be between engaging community members in something like a clinical trial, which might seem quite different to engaging community members in psychosocial or care coordination research. Do you think they actually are that different?
Well, I'm not a psycho-oncologist myself, so I don't want to claim any sort of expertise there. I'm not sure there's a major difference, to be perfectly honest. The nature of the research can be quite different, the nature of the clinical questions, but the value that the community representatives bring is, I think, universal. And it's the sorts of things I was talking about before, about the advocacy, about the communication, about making sure that our documentation is accurate and understandable, easily read, picking up the things that we might think is assumed knowledge, but which is not correct. Correcting me when I kept talking about men with prostate cancer. Someone pointed out to me that trans women can get prostate cancer, and that opened my eyes to how I was excluding people just with the simple language that I was using. ANZUP now has a policy of gender inclusive language, even for diseases that you might think are sex specific, like testicular, penile, prostate cancer, for exactly those sorts of reasons. So I think the value that people bring and the way that they contribute there's really commonalities in all of that, regardless of the type of research. And you know, we might go on and talk a little bit more as the conversation goes on about, you know, how we engage people in governance processes, in grant applications, and those sorts of things.
Brilliant. Kirsty, Beck, or Juliet, from your community's perspective, did you have anything to add to what Ian said about how it might be different? Either, I guess, that difference between a medical or a psycho-oncology trial, or the difference between sort of a large trial and a smaller study?
I had a little thought, I had a couple of things. Please tell me if you don't agree, Ian. I was just thinking, I feel like, in my perspective, our psychosocial kind of health systems research tends to have a little bit more flexibility in our design and maybe our implementation and the way that we do things. And also we tend to have much smaller sample sizes than the bigger clinical trials. So I think kind of engagement through the processes and what can kind of flex a bit is maybe different between the two things. I also feel like larger, bigger medical clinical trials, they're often provided with a lot more funding than we do get psychosocial health system trials, and that can lend itself well to having more meetings and engagement with consumers, face-to-face meetings particularly, and even things around maybe providing opportunities for our consumers or our community representatives for learning and kind of, you know, opportunities to kind of grow themselves. There are the kind of two things that were kind of flying around in my mind that might be the kind of differences that I see from a kind of practical stance, I suppose.
So more flexibility, but potentially less money.
Yes.
Less flexibility in that
always
way.
down to money. But I mean, as well as what Ian was saying, universally, I think, you know, we bring the same things, and we all, you know, our community and consumer representatives are all part of our steering committees now and our working groups right from kind of day one, and you know, they provide that kind of oversight and input across the process.
Yeah.
I guess if I can jump in with one additional, so I completely agree, Kirsty and Ian, like I think there are so many similarities. One of the differences, and I'm trying to I'm thinking as I go here, but I see that there's one of the differences is, I guess, in our psychosocial research is the element of qualitative research, which feeds into some of the work that we do. And sometimes there's probably this like Venn diagram of what consumers bring in a qualitative sense to perhaps the, you know, development of an intervention or the generation of research questions. Some of that, I guess, is done and can be done in a more qualitative research sense in our psychosocial work, as opposed to through what we might call a more traditional consumer route. So I guess that's just one of the things I was thinking about is, of course, you still need a consumer, because some of those, you know, the elements of thinking about your project from a grant perspective, or the documentation or the dissemination of findings, those sorts of things can't be done in a research sense. But I guess if you don't have a consumer that you can use, and you're doing psychosocial type research, I guess there is also, just putting my qualitative hat on, some elements of qualitative research that you can you know, get to similar places, I guess. And if we kind of look at integrating lived experience voices into our research, that we can do that through a few different mechanisms.
I fully agree with that. I think that's, even if you've got what appears to be a purely quantitative type of research design, there's a whole lot of qualitative aspects that go into thinking about the research question, why it's significant, how you communicate that, how you phrase your hypotheses, what the endpoints might be. You know, it's an artificial divide, and I think what the consumers can bring is real advice to all of us about why things are important, and you know, why you're looking at progression-free survival when all we really want to know about is quality of life, or we want to know about overall survival. You know, why are you looking at something here that's, you know, we've chosen because it's easy and quick to measure, but we don't think that's the important question to ask. That's the sort of message that we need to be hearing as we're designing even quantitative types of research projects. So I fully agree with what you said.
Juliet, did you want to add any perspective on how it might be different to participate as a community representative in these different kinds of trials, if you sort of think about the potential differences between large medical trials or smaller health systems research?
Okay, so I've only really had experience, I think, with the psycho-oncology type of research trials so far over the last year. So I can't really speak from experience comparing those two from my own personal experience. I think it's also important that, I mean, from my experience, I think, from my perspective, I think I would approach the task in the same way, with the same, you know, kind of lens. The qual versus quant, would there be a difference? I mean, what I'm looking for is the comprehensibility and also the burden on how much you're asking of the person. And I'm also trying to think, as a patient or a carer, how easy would it be to get to places if you're, for example, if you're going for an intervention that can't be done remotely, right? So, and I'm guessing that maybe some of the larger medical trials may require people to be there in person rather than the psycho-oncology type of trials, which you could do remotely. But yeah, I can't really speak from experience on this one, sorry.
Yeah, no problem. I think that what you were saying, how you would approach them, you know, potentially in similar ways, similar kind of role, I think that's quite valuable, and it's sort of, I guess, really speaking to what others have been saying, that, you know, the importance is very similar really across all of these types of studies, even though, you know, there might be some differences in how we can actually implement things. I'm just trying to, we are, I guess, taking longer to discuss things than I thought we might. So we probably won't get to all of the questions that we were thinking that we might look at today before we open up to questions, but I would like to ask a couple more. Juliet, do you mind if I ask, you know, you've already spoken, I guess, about what the important considerations are in terms of, you know, time, etc. Do you have any specific considerations about how, you know, for what researchers should think about with regard to how they engage consumers, for a start, when approaching consumers to participate in the first instance, and then any additional considerations for ongoing involvement as the project develops?
Yeah. Okay, so I think how I've been approached is through email, which is fine with me, with given enough notice. So that has been helpful, indicating, you know, the time required, a bit of a reminder as it gets closer to, I'm looking forward to getting some feedback from you group members, a bit of encouragement there. So to date, it's always been through email, and all the contact has been through email. But I think maybe it was Kirsty or Rebekah mentioned actually meeting face-to-face or online and having a bit more of that synchronous communication where you can meet some of the research team would be really helpful. I would actually appreciate that, and so that you can just get some quick questions and what exactly do you want us to be focusing on here, which is quite hard to give all that information in an email or in documents. So yeah, I think I'm not sure about others, if I can speak for other community advisory group members, but that sort of lively dynamic exchange would be quite helpful. And you might think, oh, that's a bit of a burden, you know, have to schedule a time where we meet with the people, but I think it would be actually saving time, and they're more likely to engage and give you what you need if you have even a 15-minute chat. Yeah, Tiffany's been quite proactive in that, and I've appreciated meeting her, and I'm more inclined to participate having seen a face behind the request.
Yeah, right. So that kind of time burden is offset maybe by the more personable
Yes,
and
definitely.
more direct kind of
Yeah, even if it's
interchange.
just 10-15 minutes.
Sure.
Yeah.
Beck, I wanted to ask you about, I guess, involving caregivers as community representatives or consumers in research, because a lot of your research has focused on the role and wellbeing of carers. So what do you think are the unique considerations in involving carers as community representatives in research?
Yeah. So I think there's a few things. Obviously, everyone's different, and what I'm going to say may also apply to people with cancer. But I think for starters, finding carers can be tricky. So it can be harder to find a carer as a consumer member in the first place. Sometimes, they might not identify as a carer. Sometimes carers might not link with consumer organisations as readily as well. So that can be a bit of a challenge as a start. I guess carers are very diverse. So we've spoken a lot about, having consumers and community members involved, that one person can't speak for like everybody. There's so many elements of diversity. And I think with carers, that is the same, but then there's also probably a couple of added layers of the relationship that they have with the person that they care for. So whether you're a spouse, we know from the evidence that, if you're a spouse versus if you're an adult child versus if you're a parent or if you're a friend, the types and ways of your involvement will probably be quite different. So that's something to keep in mind. And then the other element is, of course, capacity. I mean, everyone's busy, but we know that carers wear many hats, working, caring, running a household. It can be really hard to commit a lot of times. So being flexible is, I guess, really key.
Yeah. All right. And Juliet, in your role as a consumer, did you have any comment or reflection on the differences in engaging as a community representative, potentially representing a carer role as opposed to representing, or maybe not opposed, that might not be the right word, but are there differences in similarities to maybe representing a carer role as or the person with cancer, I guess, perspective?
Yes, so I think Rebekah's right there that carers are very diverse, and the relationship that they have with the patient will be different. So the input that you get from those different types of carers will be quite different. And also if they're caring at that time, or if they were a carer, like I was a carer, so I can remember what it was like. But my memories of how I would respond when I was a carer, if I was asked to give input, I think would be different from how I would respond now. There's some things that you might need to there's some sensitivities that you might need to think about when asking for carers who are currently carers, because it's very stressful. Well, I found it super stressful, and you also may not feel that open to share about all that stress, because you want to protect the person that you're caring for, and you don't want to paint them as a monster, even though you're feeling maybe a bit, yeah. So there's quite a difficult position to be in, to be open and yet to be protecting the person you're caring for. So I think that there's some extra considerations with carers. With people living with cancer, then there's the considerations of are they feeling really sick at the time, and they might not feel comfortable. They might not be ready to give you the input that you need at the time that you wanted it because they're feeling particularly sick at that time. Also considering people who've had experience being carers or patients or people living with cancer in the past. There could be some triggers in the language that is being used, or that could make things difficult as well. Yeah, so they're just a few thoughts that I've had.
Yeah, absolutely. I guess that also speaks to the importance of having somebody review the language and at the same time try to be sensitive to their other commitments as well. Yeah. We had some other questions that we had planned for today, but I'm mindful of the time, and I think some of those questions might come up if we open up to our Q&A session that we planned for the last sort of half an hour or so of this seminar. And if people run out of questions, then I'll go back to some of our planned questions. But I think probably we're happy to open up to attendees to ask their own questions. I can see that there's one that Mona's asked in the chat about whether we should be looking for people with particular expertise or whether they meet a particular criteria when we're recruiting consumers or community representatives. I might have seen an answer to that actually pop up. Ian might have answered that already. There's been some real chatting going on in the background, and I'm sorry that I haven't kept an eye on it. But I think, Ian sort of responded about supporting diversity, although we don't, but that's true, also want to reduce people just to demographic representativeness, because there are so many other ways in which to be diverse, if you like. But would people like to, if you'd like to ask a question, feel free to turn on your microphone and let us see you if you're comfortable with that, don't have to, and ask a question of the panel. If we only have silence, then we do still have some more planned questions I can ask, but I don't want people to miss the opportunities to ask questions that they might have. Okay, I might just follow up. Actually, I might ask Kirsty now, but if people have questions, feel free to put your hand up. Kirsty, some of your research involves things like considerations of things like health literacy and equity, and I know you were speaking specifically about representativeness when you were designing the questionnaire. It was a questionnaire measure, is that correct, Kirsty?
Survey,
yeah. So how do you ensure that the needs of people with limited health literacy or other equity challenges are represented, particularly considering that people with those kinds of challenges can be they can be less active or less experienced in consumer advocacy or representation, or that might be less accessible to them in a way to act as a consumer representative?
Yeah, it's a really good question, and I think it's probably one that it's quite a challenging area, and I think probably people have come up against this. I think first of all, I think building relationships and collaborations with maybe leaders or experts in these kind of areas is probably a good start for ECRs in terms of linking in with people that do this well already and get them to kind of share their experiences. And we really, secondly, we really need to make sure that we have kind of culturally appropriate communication. So making sure that we're using our plain language, that we're using jargon free. I think we've talked about that a few times today, and that we have communications in all languages, they're accessible, they're visually pleasing to people, and they're very culturally relevant as well. People may be aware of it, but I'll mention it because I've got the opportunity. But the Sydney Health Literacy Lab is also known as Shell. They provide a free online literacy editor, which actually gives you real-time feedback on how easy your texts are to read. So it not only tells you the reading grade of your text, but it also will provide you with it'll point out things like, oh, this is a really uncommon word, or you're using a passive voice, or this is jargon. And sometimes it will actually even give you other suggestions or alternative words that you can use. And it's free. You can just Google it. You can cut and paste your words into it, and it will give it to you there and then. And I feel like everyone knows about it, but you never like to assume. So, I mean, that's great. It's really useful tool for people. And, having those kind of multilingual resources are really important, as I mentioned, and they're in multiple languages, making sure that we're being diverse and we're being inclusive in the resources that we're providing. And lastly, I think just really listening to these groups of people as well, and really kind of finding out what specific barriers they have to things, and really helps us to enable us to make sure that we are inclusive and that we have equitable research ideas, and that they're relevant and meaningful as well.
Brilliant. Yeah, and you were saying earlier, I think that you approached your community representatives for that project through a cancer organisation. Is that correct?
Yeah.
So was that a helpful way to, I guess, try to approach that?
Yeah, I think as well, and we were lucky in that sense. We kind of did an expression of interest, and it was through kind of a lived experience group that they had already set up. And with these people, you often find they're very engaged and motivated group of people anyway, but it was also gave us the opportunity to really reach out to people to kind of make sure that we did include, you know, diverse communities that represented our priority groups as well. And we had, you know, it was breast cancer that we were focused on at the time, and we did have, you know, people with metastatic cancer and things like this attend. So we really were able to get voices from all of these groups and from our LGBTQI groups as well. And I mean, it was a really interesting experience. I mean, the feedback from that in itself, I remember one lady coming and saying, I'm not really going to say very much today. I'm just going to listen. Like, that's fine. And she was sat next to me, but she ended up having a lot to say. And she actually emailed us after the first meeting to say, I'm so glad I came. I really feel like I've been able to make a difference, and I've been able to make a voice for the group that I'm representing. And so, yeah, I think it's important. And these are
fantastic.
Yeah.
And great to have that positive, yeah, as you were saying earlier, I think great to have that positive feedback, that it's been a positive experience for the consumers or community members who've been involved. Yeah, not you know, it's nice to know when other people are getting something positive out of their involvement.
You should never underestimate, you know, what it does for people to be involved in things that, you know, maybe small things of words and language and stuff, but this is really important.
Brilliant. Any questions coming up? I'm going to see if there's any questions from the group before I move on. Okay. I am wondering a little bit, and Kirsty, I might direct this question to you in the first instance, but if you would like to throw it open to others, feel free to do so. Do you think there are differences between how researchers engage with consumers internationally or in other contexts compared with how this is done in Australia? And have you observed any advantages or disadvantages with regard to any differences that you've seen between Australian research or international research?
So my international experience is UK based, so across Edinburgh and in London, and the population in the UK is much larger than our population, but geographic spread is much smaller than it is in Australia. So we tend to have much less of those rural and regional challenges that we face here in Australia. But we do have very diverse communities, particularly so in London. And I worked in the East End of London, and that's an incredibly diverse community. And I have to say, my memories of this is, I've been here for 10 years now, but my memory of this is that I actually do remember there being quite a lot of support to kind of reach and involve our diverse communities. And I'm not sure if that's because the work that I did at the time, I was very clinically based. So I was hospital based in that role. And we had very readily available translational services and interpreters. And I remember a lot of our resources were, you know, in multilingual, as I mentioned earlier. So I feel I had a positive experience. Maybe I've got rose tinted glasses on now and looking back 10 years ago, but I do feel like it was good. And I think we do need to look closely at our community representative groups that we have here and think about, you know, are they truly representing our communities, and that they meet the needs that we have, and do they meet the needs of the people that we're trying to develop research and have positive outcomes for certain populations. But if we haven't got them involved in that process to get there, how do we actually know that we're asking the right questions and that we're actually, you know, going to be, like Ian was saying, are we answering the questions that are important to them if we haven't got them involved? So I'm not sure if that really answers it. I've had my positive kind of, when I look back on London, but I don't know if that's the setting as well, from being in that very clinical health, you know, services kind of hospital-based setting, and it's just more accessible and more of the kind of norm of, you know, because people are coming through the doors all the time, and there's a lot more of the kind of, maybe more of those acute settings where things have to be there and ready available there and then.
Absolutely. I was wondering about opening a question up to you also, Ian, because I know some of the clinical trials you've been involved in have been not only Australia-based but international. Do you see differences in how consumer involvement is done, and do those relate to the differences that Kirsty's been talking about with regard to representativeness? It probably depends exactly where those trials have been based, or
yeah, I think Kirsty made some good points. My experience is limited to international trials, mainly involving UK and Ireland, and a little bit in the US. So there's obviously huge chunks of the world, including our own region in this part of the world geographically, that are not included in that. So my experience is, in that setting, has been at pretty high level steering committees for what are usually large-scale international trials, and it's almost a little bit like the professional consumers. They're very, very well informed and educated. They actually understand the science and the conditions, but they're still able to bring that critical community perspective to the discussions, and we refer back and rely on them quite extensively. So fundamentally, probably not, but in terms of the details of how they're identified and engaged, trained, supported, no doubt, I think there are differences how that's done internationally.
And I've just seen your comment about whether or not international includes New Zealand. I think for the context of this discussion, for sure. And I'm guessing, obviously, with it being ANZUP, some of your research would extend to New Zealand trials as well, and particularly with response to your comment about Maori involvement. Do you think there are large differences there? Because I'm not involved in that area directly, but I really do get the impression that there are.
Well, New Zealand are decades ahead of Australia in terms of relationships with First Nations people. They actually have a treaty, and language recognition, and so many fundamental differences at a community level compared to how things are done in Australia. So I think there's a lot to be learned from how New Zealand functions as a society that we can then take across into clinical trial or psycho-oncology research as well.
Yeah. And Juliet, I was wondering whether you've got any comment, especially with regard to representativeness of language, or not excluding people using language, because it sort of relates back to your comments from previously, looking at, I guess, because we're sort of, I guess, going back to that representativeness question in discussing differences between Australian and international trials.
Okay, so I've only had experience within Australia with this, but at one of the development workshops I went to, there was a representative of a culturally and linguistically diverse consumer group. I myself don't speak other languages. I have relatives who do, so I have to sort of imagine what if they were, being a participant in a trial. But it's really important. I think there are people who can represent culturally and linguistically diverse groups. I think the Shell tool is a great tool to use for in terms of accessibility of the use of the English language, but then you would need the equivalent of that in different languages. So you can't just say, well, I'm just going to put this into Russian or Mandarin or whatever, because then it could be at the wrong level within that language. So I don't know if there's tools that you can use that are like Shell, but for other languages. Yeah, not sure.
Yeah, that would be helpful. Maybe we should look into it. Thank you, by the way, Kirsty and Juliet, again, for raising Shell, because I was aware of the Health Literacy Lab, but I don't think I've been using Shell to its full capacity. So it's fantastic to have that reminder. Yeah, no, I agree. Ian's just made the comment that AI is not a solution, and you can certainly get some really interesting and not very accurate and not very helpful translations if you use AI for that. So just checking with our attendees, do we have any questions that anybody would like to ask?
Just while we're waiting, can I just make a comment about grant strategies.
Sure.
And overall conduct of research. So it's inevitable, I think, that more and more we're going to see meaningful community engagement as a criterion and a prerequisite for grant funding. It was already the case for the priority-driven scheme from Cancer Australia, which is now no longer there, but we'll see more and more of it. So we need to be thinking ahead of that. NHMRC is not caught up with that. So if you want to have a community representative as a chief investigator, the system is really, really set up against them. One of the first things that they see as they go into Sapphire, trying to set up a Sapphire account is hard enough for anybody. But if you're someone that doesn't have an academic background, how do you put in your 10 best publications? You know,
Yep.
So we and other groups have written to NHMRC pointing this out and asking for that to be addressed as a matter of urgency, and they wrote back and said, we're just letting it all settle down for a while and we'll look at that at some point in the future. So I don't think they're taking it seriously enough, and I think we all need to advocate for that. The way we've dealt with it in terms of grant applications is for each of those 10 fields, I just put in C below, and then for the explanatory notes, I've just said the value that this person is bringing to the investigator team is not measured in publications. It's this is what they're bringing to it, and that actually I think reflects wording and information that you should be putting in your grant application as well. When you're talking about the investigatory team, I think we should be trying to make community representatives chief investigators, wherever not associate investigators. It's meaningful engagement by doing that, and then really spelling out exactly what that means, how they are involved in developing the research concept, in implementing the research project, in interpretation of the results, in dissemination and uptake of the results, in everyday project management. And if you can't answer those questions, then I think you really need to have a good hard look at yourself as to whether you are seriously engaging the community representative meaningfully in the project. Can't articulate it in that way. Maybe you're not. Maybe they are actually just a number there as a tick box to try to get your grant funded, and it's of no value to the project or to the team, and it's certainly of no value to the community representative.
So it's a good litmus test, and I agree. And we've also in our group had that, I guess, challenge of trying to use the NHMRC online forms, and it's difficult. How is a consumer CI supposed to put in their 10 best publications? And it can be quite off-putting and overwhelming for not only the consumer but for the rest of the team who are trying to advise them as to how they should fill out that form. So we've probably covered this a little bit already, but how I would like to ask all of our panellists, I guess, to sum up how researchers can ensure that they are truly listening to and incorporating feedback from consumer representatives rather than just checking a box that they have a consumer involved.
I'm happy to jump in first. I mean, there's lots of things that we've already spoken about. I think one of the things that we have to do is being really mindful of the time and expertise that our consumer representatives bring, and trying to be strategic about where we use their time to have best effect. So, you know, and it may be more time for you, but that's okay. I think it's okay for, as the researcher, that I'm the one, I'd like to spend time preparing things, and then, you know, getting the consumer to be, like what Juliet was saying before, you know, directing them to specifically what it is that you need, laying out documentation clearly. So I think those are some of the key issues of really utilising these experts in the best way possible. And I think, you know, that, as we were talking about before, that synchronous communication with the consumer is also crucial. So, you know, meeting with someone, getting their feedback live, and then you making the changes is a good way to be able to actually practically have a consumer on board in your project. Setting up a time, setting up an hour and going through the documents with them, and then incorporating their feedback, for example, might be a good way to have someone have high impact in their involvement, but low administrative burden on them. So I guess thinking about it from that lens, I think, can be helpful to getting really meaningful involvement.
Excellent. Yeah, I very much agree. Does anyone else want to chip in before I ask another question?
I'd like to say a couple of things. I mentioned before about the qualitatively different nature of the contribution that they make. It's not just a single vote, but also, just to take the temperature of how well it's all working, ask them, are they satisfied with how things are working, whether they're being heard, whether they think that their contributions are valued and valuable or not? Is it worth their time? People vote with their feet. And I'm really, really proud of the fact that the feedback we get from all of our consumer advisory panel members at ANZUP is that they absolutely love being part of it. They're extraordinarily generous with their time and expert contributions, and they really feel valued. And I'm very, very proud of that and very grateful to them.
Excellent.
I agree with what Beck and Ian have said there. I think thankfully we've moved forward a long way from kind of almost tokenistic the involvement of our community advisory representatives. And I think something that we do need to remember is that, if we have these community environment and representatives on our panels, is that you need to be flexible and open-minded. If they're on your panel and they have ideas and things, you need to be willing to adapt and to change and to take those ideas on board as well, I think is an important point.
Yeah.
And can I just add, to that? And so when you have taken them on board, that feedback loop is really important. And so I love that suggestion that Rebekah made as well, that you're sort of working with the person and you're making the changes, but also something that I think may or may not help is that you can let the community advisory member know that they're not the only one that's giving feedback, so that you say we're getting feedback from a few different groups, so that they don't feel I have to represent all, people with breast cancer, for example, but that you are taking into account your feedback along with other people's feedback to make this study better. And there was one more thing I wanted to say, which has now slipped my memory. Anyway, so I think that the feedback is really important, I think.
Yeah. And to ask what will probably be our last question, because we've got 4 minutes to go, since this is an ECR seminar. For the last question, I'll pick from each of you, what advice would you give to ECRs who are new to engaging with community representatives? What do you think is the most important piece of advice or the take-home message that you would give them?
Hard to pick.
Do you want? I can go first if others. Can I have two? Just because I have a list of about 6. So I'm happy to. I'll do 2. Think broad. Think broad in terms of community can mean several different things, and for your project, it might mean people who have cancer. It might mean carers. It might mean support group leaders or whatever it is. So I guess think broad in terms of who it is and also how they're involved. The perfect example is having someone who's there from, idea generation all the way until dissemination. But for me, that's been really, if I'm honest, it's been hard sometimes to, projects are long and slow. And so I guess knowing that it's okay if it's iterative, if people come for a season of the project and then, for whatever reasons of capacity, they need to not be as involved, that's okay too. And it's not a failing of you. So I guess think broad, and then also partner with and link up with and start to have a reciprocal relationship with community organisations, whatever the work that you're doing. Link up with them. So, for example, I have a good relationship with Carers New South Wales, and it's a bi-directional relationship, and it means that they have great, they've got their finger on the pulse of what carers' needs are, and so they can contribute to my work. I contribute to theirs, and they also have consumer advisory panels that you can gain further access to. So, I guess think about what community organisations you can contribute to and also what they can contribute to your work.
Excellent.
I was just going to say the most important thing to take home from me is listen, but really listen, like listen to what the community representatives bring.
Excellent.
One more thing is, from a PoCoG's perspective, is that, you know, if people do want to have community representative involvement and they don't know where to start or they need some support, then please get in touch with us at the office. We're there to help.
Fantastic. Ian, you're not muted. Did you want to add anything as far as
just to say, listen and avoid the temptation to keep talking.
Yeah, great. And Juliet?
So I'm going to have two as well. One is to allow lots of time, and then have sort of drip feed, so, you know, reminders. So don't expect something within a week, like that's a little too short. I would allow at least 2 weeks notice, if not a month. And the other one is to be really explicit in what is it that you want them to look at, what do you want feedback on, and in what order do you want them to look at these things. So yeah, just to make life simple, the community advisory group members, as I've said, they're busy, and also it's easy to get confused, and then time is wasted in that. And if somebody has been confused with the documents, this is what I wanted to say before, that is also feedback. If someone gets confused by something, then your participants are likely to get confused by it as well. So if someone's just missed a whole chunk of something, that is also feedback. So yeah, but being explicit upfront is, I think, really helpful.
Excellent. Well, thank you, everybody, for your helpful advice and relation of experiences. I see we've got some chat as well, especially also with advice that as a PoCoG member, you can get in touch with the PoCoG office, I think, as Kirsty was saying. It's 1 o'clock, so we will wrap up for today, but I'd like to give a huge thank you again to our panellists for answering all of these questions today and sharing perspectives. And I believe that we've recorded this, so it should be coming up on the PoCoG YouTube channel after a short interval of time. Thank you so much, everybody.